It's my pleasure to give this presentation 10 minutes on video consultation trends during the pandemic. I'll share some experiences from the PRICOV-19 study, the Quality and Safety in Primary Care in Times of COVID-19 study set up in Ghent University in Belgium, together with some of the World Organization of Family Doctors, the European branches networks for research and quality improvement and patient safety. And in this study, which is part of my own PhD journey, I will share some of our insights about the impact of practice level as well as country level characteristics within European general practice based on this cross-sectional PRICOV-19 study. It's a study in 38 countries on the organization of care in general practice during the pandemic. And we had close to 5,500 GP practices participating all over Europe and Israel. And the question itself included 53 items divided into 6 overall sections. So it was about the patient flow, infection control and prevention, information processing, communication, collaboration, self-care, as well as practice and participant characteristics. And what is interesting about this study is that it was entirely funded by in-kind contribution by the participating institutions, and then a little financial support received from the EGPIN. More than 48 research institutions participated, and the outcome already has been quite impressive. It has so far led to 13 publications based on the international PRICOV-19 database, and in addition, 21 publications on the national databases. And right now, additional 8 national and 5 international papers are under review. And my own paper here will be submitted shortly, sharing our learnings about video consultations. So the theme of today is about how can we move from research into practice and policy. And the PRICOV study actually already published this opinion paper, moving forward after the pandemic, lessons learned in primary care, where it really got the message through that primary care actually reorganized itself quite well, reacting to the pandemic. And in this study, we aim to describe the variation in the use of video consultations in general practice across Europe during the pandemic. But not only to describe the variation in the use, we also explored associations between the use of video consultations and various characteristics at practice level and at country level. First, to guide the selection of the proper items in the survey, we did a rapid literature search to be evidence-based and discovered some of the major themes back then. And also we had additional questions which were shared with country coordinators of the PRICOV-19 study. So we had these 53 items in the original survey, and then 15 more questions were shared with country coordinators. And out of all of those, we then selected the proper items. We included 5 practice level and 9 country level characteristics, in addition to characteristics of the COVID-19 itself, as it has been described as a facilitator of the adaptation of telemedicine across various studies. So we included these in the analysis as independent variables. And we used those to build a linear mixed model analysis at country level. And then we examined 5 models incrementally. So we took these factors at practice level, and then we added step by step some of the country level characteristics. And finally, we had a model where we included everything. So we looked at this intercept regression model. The characteristics included at practice level were the number of patients with migration background and low language proficiency compared to the average practice population, the main payment system, type of employment for GPs, number of patients listed, and location. And these were, of course, selected, guided by the rapid literature search, as well as by varied analysis. And many of these questions about the patient composition were, of course, overlapping. So we chose those that had the most interest for us. And at country level, We looked into whether there was areas with no limited internet access in that given country, whether internet was affordable for nearly all patients, whether video consultations could be reimbursed, and by whom, whether video consultation was actually defined, was it asynchronous or synchronous, whether it could be used for all kinds of consultation or for COVID-19 cases only, and whether it could be offered to all patients, and finally, whether guidelines on teleconsultations were actually in place. We looked into use before the pandemic, and as you see, it was a slow uptake, not surprisingly. But when we looked into how it was picked up during the pandemic, and during, we mean by, at the given time for that specific country, of course, giving the respondents to the survey, we see a complete different picture. Depicted a little bit differently. On this graph here, we see that it was mainly the UK, Luxembourg, Scandinavian countries, and France that were most adaptive to video consultation in general practice, whereas Portugal, Spain, Serbia, Bosnia, Herzegovina, Switzerland didn't pick it up to that degree. This is an adjusted model, taking these various respondent per country into consideration. So it is a little bit skewed towards the mean here. So what we discovered was basically that fewer than half of all the participating GP practices from the 38 countries had used video consultation during the pandemic at the time of the survey. That having more patients with migration background and low language proficiency, being self-employed, having more patients registered with the practice, being urban-based were positively related to the use of video consultations. And when we look at the country level, only accessible and affordable internet was significantly associated with use of video consultations, which makes perfectly sense, since it being a prerequisite to actually offer this kind of remote consulting. Now, for implications, our study have provided more insights into specific practice level characteristics that facilitated the use of video consultations. And we also provided comprehensive cross-country comparison, highlighting that while some factors are universally influential, such as internet access and affordable internet, others are more context dependent. So we here highlight the importance of tailored strategies to promote the use of video consultations in general practice, considering both the practice level and the broader characteristics. So to guide further research, we need to develop robust measures of outcome measures at patient level, its cost effectiveness, and the quality and safety of remote care. This is also what has been claimed already. But in addition to that, we believe that researchers should also develop a more nuanced understanding of how these various factors actually interplay, influencing the uptake and effectiveness of video consultation by elucidating their impact. And this is why it's so important, as we've heard from Trish and Tony already, to really know what's going on locally. So this study is very much about that we need to be curious about what's going on at the practice level. And talking about this using Amara's law, one could consider, and we can discuss this a bit later, where are we at this timeline now? Are we still overestimating the benefits and potential of, in my case here, video consultations in general practice? Or has someone picked it up in a way and making it work really well, like we've seen with migrant background patients and similar, so that we are maybe underestimating the benefits? So maybe we can discuss a bit how to think about this and how to guide policymakers. That was it for me. Yeah, happy to have any questions later on.